morning, everyone. Good. All right. We'll go ahead and get started now. Good morning, everyone, and welcome. Thank you for joining us this morning for this media availability. The purpose of today's presence is going to be talking about over 1 million COVID-19 tests administered by the County of Santa Clara and its partners. That is a significant milestone in the fight against COVID and the ongoing battle against COVID-19. It is a testament to the staff and the numerous teams at the county organization at Valley Medical Center coming together to stand up a massive testing operation literally within a matter of days and weeks to be able to meet the testing needs and support the ongoing COVID response by the county. This is also a reflection of our community's commitment. This is hundreds and thousands of individuals, essential workers, those who support our everyday needs, making sure that they're tested for the safety of not just their own family, but of their community and their own health. So this is really to applaud our residents for answering the call, making sure that testing is a part of their regular routine. This is an appreciation of the numerous county staff, nurses, medical service providers who are still out there in the field today and every day, making sure that COVID-19 testing is readily available, accessible, and provided in a respectful, culturally competent, and language accessible manner. So we do have a few speakers today who have been at the center of this operation. We will hear from Dr. Marty Fenstersheim, the county's testing director. We will then hear from Ms. Christy Chung, who is the county's testing coordinator. She is overseeing all the operations and making sure that these testing sites are available and operating smoothly. And we'll hear from Nurse Soria, speaking on behalf of the Valley Medical Center, who continues to lead joint efforts to make sure testing is widely available in the community and at medical health providers. So we're going to get started with that. At the end, we're going to go ahead and head into questions and answers. At this time, Dr. Marty Fenstersheim.
Thank you, Betty. Welcome, everyone. Thank you for coming. We're really excited and happy to be here today to talk about the pandemic and our ability to test. Since the pandemic began, so this is earlier in the year, we have now done over 1 million tests in this county. Our ability to test has increased tremendously since earlier in the year. We are now doing anywhere from 7,000 to 8,000 tests a day. It's been a community-wide effort. No one individual or facility has done it all themselves. The county system, however, has done the bulk of the testing in our community. However, with our private providers, our community clinics, and also the state, who has provided some testing, we have seen a constant increasing in the amount of tests that we've been able to provide. It remains very, very important to be tested if you have COVID-19 symptoms, if you've been a contact to a case of someone having COVID, as well as all of the essential workers and frontline workers, such as those who are working in healthcare, our first responders, and again, all the frontline workers, such as those people in grocery stores that are always there to help us purchase our foods, restaurants, the drivers of all of our trains and buses, and others on the front line. And to remind also everyone who are frontline workers that it's not just one test, that you should be tested on a regular basis at least once a month. Our level of testing has enabled the county also to move and remain in that orange tier, which is almost the least restrictive, and has permitted various businesses in the county to stay open and to open. But we have to remain vigilant and continue to wear our masks and stay socially distant and take advantage of the large testing capacity that we have in this community. Appointments can be made online for the county sites through private providers. Our county website name is sccfreetest.org. sccfreetest.org for individuals to go online and make an appointment for one of our testing sites. And again, if you have a provider, you can also call your provider, and under the county's order, they are required, if you fit into one of the categories I mentioned, to also provide a test for you. I will end there and turn this over to our testing coordinator, Christy Chung.
Good morning, everyone. My name is Christy Chung, and I'm the testing branch director for our Emergency Operations Center. And I oversee the testing, whether it's county testing or testing sites external to the county. So surpassing 1 million tests is a tremendous accomplishment that was only possible through our partnership, particularly with the cities across our county. We want to thank each of the cities that we have been working with who have been able to host a site to provide testing for their local community members. We've also heard a lot of positive feedback from these sites, so we really encourage people to take advantage of our regularly rotating city sites. Additionally, our testing sites have come together as a product of a lot of collaboration between our county departments. And there are many staff and departments that are behind the scenes, including our Emergency Operations Center, VMC, Public Health, and also, as you guys may have heard, our fairground site, which is up to 2,500 appointments per day, is actually a very large operation. Our Parks Department was in charge of all of the logistics for that site, and also Roads and Airports helped us design and engineer that site. So it really has been a collaboration between many different departments across our county. So this is truly a team effort across Santa Clara County, both public and private, and we look forward to our continued partnership as we continue to make testing free, easy, and accessible to everyone in our county. Thank you.
Hello, I'm Kimberly Soria. I'm the clinical coordinator for Santa Clara Valley Medical Center testing. First and foremost, I wanted to impart that Santa Clara Valley Medical Center is really committed to supporting our community by providing this free and easy test for all. We, in a joint effort with other departments in the county, led by VMC, we've actually been responsible for over 30% of the tests in the county. And as Dr. Marty Fenstersheim has said, and also Chrissy, we have testing sites that are open to everyone. We've tried to make it as easy as possible, including options to schedule an appointment or non-appointments. We have sites for people who are sick and have sites for people who are not sick, but need to be tested because they've either had contact with someone who might have had COVID or they've interacted with people at work, or the public at work. And as we said before, insurance is not required. There's no charge at all to the person being tested. It's fast and it's painless. The swab only goes up about half an inch up the nose, and it's usually less than 10 minutes for the whole procedure for any of our testing sites. I want to thank again all the nurses and testing staff and disaster service workers for doing their part in the response to the pandemic. Thank you.
Okay, again, as a reminder, anyone can be scheduled or receive a free COVID-19 test here in the county by visiting sccfreetest.org or calling 211. Operators will be on the line to help you make sure that you can schedule a test for yourself. So we're going to turn over to questions now. Any questions?
Yeah, I have a question for Dr. Marty. In a lot of other places, a lot of other states, it's much more difficult to get tested. How much do you think that Santa Clara County's increase in testing is helping deal with the pandemic and controlling it as much as possible?
So the question was, in many other states, there's sometimes a difficulty in getting a test as easy as it is here in Santa Clara County, and how has testing helped us in dealing with the pandemic? Well, it is easier. It certainly was a struggle early on to get enough tests, but with, as we have said, all of our community partners and everyone pitching in this community, we've been able to get those million tests done. What is the function of doing testing? Well, testing is one tool in combating the pandemic. If we don't know who's infected, then we can't keep that infected person from exposing someone else. So the more testing we do, yes, we may find, and we do find more cases, but then we are able to educate those people that are infected and to keep them safe and others around them safe until they are no longer infectious. So I think the numbers of tests we have done has really aided us in being able to keep our numbers so low, and our positivity rate, which we haven't talked about, is under 2% at this point for the county as a whole. And you know, you can look at that number and look at some of the other states around the country, and we are doing quite well. And so thanks again to all of those that have assisted the county and the people of Santa Clara County in having this amazing testing capacity.
While you're up there, I do have one follow-up. Last month or 2 months ago, there was a news conference like this where officials were very critical of some of their partners, some of their private partners, and places like Kaiser have stepped up and now are offering, for their members, drive up, no appointment needed. How important is that?
So the question was, early on, not all of our providers in the community have stepped up to provide the numbers of tests perhaps they were capable of, or had certain barriers to providing those tests. We have seen now that those providers have all stepped up and have made it much more easier for their members and constituents to get tested, and through the help of a testing order that was issued by the health officer to make sure that the providers provided those tests to the membership and the constituencies of those providers' facilities.
Next question. All right, I think we're good. Thank you everyone for coming out.